Welcome to MedTech Smarts with Rita, the podcast where we bring you essential insights for MedTech executives. Today, we're launching a special series called Before You Build It, Lessons from 25 Years of MedTech Startups. In this series, we'll dive into the realities of building a medical device startup, from securing funding to navigating FDA clearance. For our very first episode, I'm joined by two seasoned voices from MethodSense, a firm that's been helping bring innovation to market for more than 25 years. Rita King, founder and CEO of MethodSense, is a regulatory and quality systems expert who's helped hundreds of companies avoid costly missteps. Alongside her is Richard Holcomb, Chief Growth Officer at MethodSense, who brings deep startup experience and works directly with founders to align business strategy with regulatory and quality paths. Together, Rita and Richard have seen it all, and today they'll unpack what most founders wish they'd known early on so they could get it right from the very beginning. Thanks for joining me today, Rita and Richard.
Thank you, Anna.
Good to see you.
So, we all hear stories of brilliant ideas that never make it to market. What actually causes most promising startups to fail? Not from lack of innovation, but from a lack of strategy.
You said it, the lack of strategy. So it is very true that one of the things that founders forget to consider is the regulatory strategy, which is what is enabling the company to understand the regulatory path that they will take. Because the difference between a 510K and a de novo could mean millions of dollars, and also a different time to market. So starting with the strategy first is really important. Richard?
Yeah, I mean, so I've looked at thousands of business plans, and I've funded or helped fund, 30, 40 companies in the last, we won't say how many years. And at the end of the day, a medical device company is really, there's three legs to the stool, right? There's product. You got to have something that meets a need that somebody wants, that solves a problem. And almost all the companies I see, they have that. Right, really smart people came in with a really good idea, and they've got a product, and that's where they start. But the other two legs are strategy, right? You got a product. How are you going to get it through the FDA? On through how are you going to get it into market, right? And then funding, and which fits into strategy as well. So how are you going to get your bright idea, your product funded, so that you get it built and you get it through FDA and you get it into the market. If you've all sat on a stool, if one of those legs works and one of them doesn't, then you fall off the stool and you don't get there. That's what I see most often, is that 90% of the energy goes into the product, and a big chunk goes into trying to raise money, usually out of sync with the product life cycle, and certainly out of sync with the regulatory life cycle, because it just tends to be an afterthought when it really needs to be a key idea up front, so that everything is timed together, in sync, and moving forward at the same rate.
Yeah, and I can expand a little bit on what Richard is really saying, because when you're actually have received funding, and you have received funding, as I mentioned earlier, for a 510K, and you're thinking that clinical testing, for example, is not important, and then you find out that your product is a de novo, which may require clinical testing, now you may need to go and raise a few more $1 million, and the timeline will be different. So understanding the regulatory strategy, we also call it regulatory roadmap here at MethodSense, sets you up on the right path to success.
Yeah, and I think one of the things that you see a lot is, if you're smart enough to come up with a medical device, you've probably got some few advanced degrees and are a really smart person, really successful at what you're doing in life. But if you haven't done it before, and maybe if you haven't done it several times before, you don't understand the regulatory side. So it doesn't mean that you're dumb. It just means that there's a whole world out there that you don't have experience with, and it's required. You won't get your product into market if it doesn't successfully pass through the FDA. So you've got to concentrate on that part as well, to getting there.
Yeah, It's interesting what you just said. It really brings up the idea of, I remember my parents always telling me, you don't know what you don't know. And so I think that's a perfect example of the things that people are missing out on because they don't realize the correct steps. And you guys have been in this industry a very long time, especially combined, so you've seen mistakes happening repeatedly. Earlier you mentioned Rita, the roadmap. So how does MethodSense help startups prevent themselves from becoming existential problems?
Yes, actually, this is a great question. And one of the things that we do, and I believe that we do it different than other companies or other regulatory firms, is that we don't focus just on the regulatory problem. We focus on the business problem. And as Richard said, we focus on really what's going to create a success with the product, this brilliant idea that this doctor or this founder had. Sometimes the problems that come to us, they're actually coming because somebody's trying to save a problem that their mother had or their grandfather had, or they experienced a lot of challenges. So what MethodSense is doing is first paying attention to how the idea was created, why this is a great idea, how big is the market, and that also gives us an understanding of how excited the investors will get. That also helps us understand how patient they will be with the regulatory pathway. Because when we look at a problem or at a product, we try to understand its journey. And the FDA calls it the indications for use. Because every device will have a specific indication. But depending on the idea, a particular device can have a lot of different indications. So understanding this idea and understanding what can be a ladder of indications, like what could be the first one that maybe can give us an opportunity to go to market as a class 1 device and later as a class 2 device, maybe later even as a class 3 device that can be some sort of a diagnostic application. So that is very important to us. Then understanding the founder pressures or the company in general pressures, because they may have tried this idea a few different times and it has not succeeded. So again, going back to making sure that we fully understand the problem, the company, the culture, the journey they have taken, helps us understand what we need to do so that we can bring some relief, some success that can be both regulatory and business. So that is what truly differentiates us. Understanding regulations well, understanding the business well, combining the two, and figuring out how to fit it in the culture that we're working with.
You know, that's important, Rita. You know, there's a saying in the venture capital world in general, which is, you know, the fastest way to lose $1 million is to raise $1 million when you need it to. And sort of generically, you know, a non-medical or medtech device or company, a lot more things are in your control, right? Yeah. You've got developers, you're building a software product, you're moving along at your own pace. You don't have someone like the FDA, a regulator, in the picture that affects the timeline. Yeah. Well, if you're only judging your financial need, your funding need, on how long it's going to take you to build the product, and not factoring in, you know, where am I in the FDA process, and you know, what of the different types you just mentioned, because they all have different costs and they have different timelines. If you don't understand that big picture and have a clear view of how you're going to get through, you're probably not going to raise enough money because it's probably going to take longer than you thought it did. So it's really important with a medical device, with a medtech device, that you understand the product and the regulatory when you're dealing with an investor or a funding source.
And also, Richard, we can also remember of examples where founders have made promises to different investors, and then they have come to us with those problems, and we have to go in the boardroom to explain to those investors what the company has been doing, how big the idea really is, and why they need that additional funding, because maybe it was not understood. It was not understood as well, or They look at the additional $1 million that the company needs, and they think it's the end of the world, but it's in reality, that freedom that $1 million is going to bring will bring multiples to that board or the investment team.
Yeah, exactly. I mean, sort of a good news, bad news scenario, right?
That's right. That's right.
We go into the boardroom and we go, well, the bad news is it's going to take longer and it's going to cost $1 million more than you thought it would. But the good news is that when you get out the other side of this, it's going to have a much larger market opportunity and chance for generating a lot more revenue for you. So it's good that you need to spend another $1 million. And I'm always impressed, Rita, with I'd say 9 times out of 10 we come out of that board meeting with the board going,
yeah,
okay, where's the checkbook?
That's right. That's right.
Because we're the companies are solving big life-altering problems, and there's a financial reward for that in the end when it all works out.
Well, I think then with many startups, especially with funding and everything else that goes with getting one started, everything that's going on, quality systems may not be top of mind and even end up taking a back seat to other priorities. So when do you think it makes the most sense to start thinking about QMS and bring it into the picture for a founder of a startup?
Yes. Do you want to, Richard, did you have a thought process?
The obvious answer is day one, because you can't get a product through FDA without a QMS. All right. So, and that QMS has to really have everything in it. It needs to have your design documents and how you got to where you are and all those pieces and parts. And if you show up, I've got the product finished, I'm ready to take it to the FDA. Oh, I guess I need to take all these files and Word docs and Google messes and spreadsheets and dump them in something so that the FDA will be able to find them. It won't work that way, and it'll cost you a whole lot more time and a lot more money. You should start with a QMS in the beginning.
Yeah, and I will add to what Richard says. Not every QMS, it's not like one size fits all. We know that. We recognize that. We live that every day. The pressures of the timeline are really big. So we like to right-size the QMS. However, what we don't like, what I always say to different companies is, let's not make the QMS a paperweight. We want to make it work to our advantage, which means that if we're building a submission and we're not ready for the full implementation of the full QMS, as Richard said, what do we need? He mentioned that maybe the product lifecycle procedure or the design controls procedure is the procedure we need to have in place so that we can build the material that's going to go into our submission. And maybe we do need the document management so we know how to number our documents and put them inside our document management system. So that's really important. And maybe we can wait for other procedures, such as complaints, for example. Our product is not in the market yet, so we can wait for certain procedures. So the right QMS is very important. A challenge that companies have as it relates to QMS is that because they think that it's not as important or it doesn't really provide a differentiation, instead it slows them down. They may, if they believe that it is important or if they believe that it is necessary, what they may do is they will go and they will purchase a set of procedures, let's say from somebody on the web that sells them for $150. And now you have 35 procedures for $150. What a bargain you got. So now, what happens? You were better off without it than with it. Because what you just did, you committed yourself to a set of procedures that you cannot even understand and you cannot even follow. But if you were audited afterwards, you have promised that you were following that QMS that doesn't apply to your business or doesn't apply well. It doesn't help you differentiate. It asks for, let's say, 25 signatures and you're only 2 people in the company. So there's so many little details and so many examples that we can go into it. But the important thing to remember is you don't have to do everything up front, but you need to right-size your quality management system, and then you need to make sure that you have the right team that can help you utilize that QMS to differentiate you, to help you achieve efficiency.
So if it isn't one size fit all, Then is it fair to say it's less about buying a big platform and more about building something that grows with you and won't hold you back later?
Exactly. I mean, you're a two-person startup, and so you're not a MedTech device. You're something else. You don't go out and buy SAP, right? It's too big. You buy something that's appropriate to the size that you're at, but you want something that's going to grow with you. And not only is this important for getting through the FDA, but at some point you're probably going to want to sell this company. You're going to have a product in market, and you're going to want to, have a bigger strategic or maybe a financial investor buy the company. They're going to have the same questions. Do you really own the IP? Where did the idea come from? The information that's in that QMS, which by now might be 10, 15, 20 years old, depending on how long it has taken you to get to the point where you're ready to sell. They've got to be able to go back and find that information to know that you really do own the IP to this product.
Yeah.
So, yeah, start at the appropriate size with something that's expandable.
Expandable, configurable, right? And that's what we have done here. That's part of what we're trying to bring to
what we do every day.
Yeah,
yep. That's all we do.
That's what we try to do here at MethodSense with our technology platform, Looming Logic.
Earlier, you mentioned funding, so I'd really like to talk about investor dynamics. What should founders stop saying in the pitch room when it comes to regulatory?
So the thing I hear most often, because you're trying to convince an investor to give you money, but you're trying to convince them that you don't need too much money. So you say things like, for $1 million, we could have this all done in 6 months. Probably not. It just takes longer than that, and it might cost more than that. You don't really know what it's going to cost if you go back to our early conversations about if you haven't done that regulatory roadmap and have a good understanding. So over-promising, under-delivering, and even though the company might be doing well, the fact that you set the investor up with a bad expectation, when you come back, short of the finish line and say, well, we're going to need another $500,000 or $250,000 or $1 million because these things that happened that we didn't know about, that we should have known about in the beginning. Now you're a problem child. No investor wants to be told, well, I need to put more money in to save the money that I put in earlier. And it's unnecessary. So you end up with this bad dynamic with your investors. They don't trust you. They don't think you know what you're doing. Having an honest understanding of what your actual pathway through product development, through regulatory and into market is the safe way to get the right investor and get the right amount of money from the investor.
Yeah, and it takes us a little bit back to the strategy too, because a lot of times when we get companies that they come to us and they feel almost desperate as to but I told my investors they don't understand. The FDA told me something different. The investor story is very different. As Richard said, what we hear is, but they told me 6 months. They told me that $1 million is enough, and now they are telling me something different. So let me give you another example. So that investor now, who's getting really tired of the promises, needs to also hear something different. And this is where the strategy and the experience can really make a difference. So let's imagine, and this is real stories that I'm sharing, you have a product that they thought that, or the company thought or promised that it was a 510K, which is let's say a class 2 device 510K. They went to the FDA, and the FDA explained to them that no, the product is a de novo, as I mentioned earlier. So the de novo product now requires a clinical study because of its, let's imagine some AI application that's really differentiating. It's going to change the world in the cardiovascular space. And it's truly differentiating, as I said. It's going to really make a difference. So we do need these clinical studies, and we need a lot more money than what we got, probably a few more million. The strategy could be that based on these indications for use, that product may not only be a de novo, but it may also qualify for something called a breakthrough designation. So what does this mean? Now we have the ability to differentiate in the marketplace as being the first device, a breakthrough device in that space, which it sounds good, and it is good. it gives us multiple benefits, and one of the biggest benefits is because we need a clinical study, we can have communications with the FDA a lot more often, which means we can de-risk that clinical study as well. But the breakthrough designation also allows us to potentially attract additional investors, because it's truly the FDA has given you the designation that says you are unique. Not only unique that you already know and you need the clinical study because you are the first one. And usually, let's step back for a second. When the investor hears de novo, and if they have heard it before, all of a sudden what they hear is the following: oh my goodness, de novo. That means that I'm going to pay for this clinical study to get this product on the market, and then the next competitor is going to come behind, going to use my product that I just paid for to bring the next 510K to the market. And that's a real fear. But if you are actually combining it in the strategy with some additional differences, such as the breakthrough program or the STEP program, the Safer Technologies program, now you can gain time and have a differentiation for your product, and you create a great collaboration with your investors and with the FDA. And you can make both the trinity of the founders, investors, and FDA all work together for the better good, which is the patient who's going to receive the product at the end.
So we've talked about what founders should stop saying in the pitch room. What have you guys personally found that great founders just do differently?
I think so much is wrapped up into the presentation, right? As founders, we spend a lot of time trying to get just that perfect presentation together to tell our story and to say how big the market is and to say what the problem is that we're solving, right? And again, going back to some earlier comments, if you're not building that pitch deck in conjunction with the timeline that you're going to need to get through the FDA and into market, then you're almost certainly building something that's going to set up an expectation in the investor that you're going to fail at. And it's really disheartening. I mean, a lot of the clients that we get at MethodSense show up because they're in trouble. Right? They're either in trouble with the FDA because they've done something wrong, or they're in trouble with their investors because they haven't met those expectations that they set. And we look at the product and we go, wow, what an amazing, incredible product. This needs to be in the market. This could save lives. This is fantastic. But because of not setting expectations right, not putting systems in place like the EQMS is right, they're going to fail, or they could fail without some remedial action. And that's always a sad day for me when I see a really sharp founder or a really good scientist who's come up with some really great thing, and it's like they failed because they didn't get the paperwork right. Yeah. Is one way of looking at it, and they could have. And if they had built the idea of building in the submission in line with the product development, then they would have probably gotten to the finish line without being in trouble with their investors and with the regulators, and be in market sooner for less cost.
Yeah, and
saving lives that much.
Right, and creating partnerships. That's what we are looking for. I think this is what we're looking for the founders to know and to look for competency in their partners. Just like they're looking for investors that they can understand the product and they can get the idea of how big their idea is. Same thing for their partners, whether it's regulatory partners or it is developer partners, manufacturing partners. The partnership is very important. People that they have done it before, that they understand them, and they can be besides them when they need to deal either with their investors in the boardroom or with the FDA when they're in the hot seat trying to explain why that bench testing or that clinical study or the number of users that they had are enough for what they're trying to demonstrate.
If you could each give one piece of advice to a founder that's building their first medtech product, what would that advice be?
generically, the advice I always give a founder when I get asked that question is, don't use a cheap lawyer, right? Because if you don't set the paperwork up for your company day one right, then 10 years down the road, that's going to come back and bite you, and you're really going to regret it. And I have seen through multiple M&A transactions that be true, that it cost millions of dollars to the company in the end because they did something wrong at month 6 on the legal side or on the accounting side. That's even more true for MedTech, because there's even more things that you can do wrong if you don't use the right set of advisors. So my generic advice is know what you don't know, and then hire the best you can advisors to fill in those areas that you don't personally have expertise in. Build a team.
I agree with Richard completely, and I will also add, think of the FDA as your partner. So who are the partners that you will choose to help you demonstrate to the FDA that you see them as your partner, and you can truly differentiate the product. Just like you want your investors to recognize what a great idea you have, you want your regulators to recognize what a great idea you have, so that together you can bring that safe product to market.
Exactly.
Earlier you mentioned that people come to MethodSense whenever they're in trouble with the FDA or they have a problem. What's the biggest reason companies come to MethodSense and stay?
Well, as we shared earlier, I think we get them. I think we really understand, particularly the growing business or the challenge that every medical device company has on how to grow. We really understand that. We understand the founder, the founding team, the growing team. As you go through the different stages, you go through different types of pains. So we really understand them, and we bring together the strategy, the expertise, and the technology. And those items together is what actually helps us differentiate. Richard, did you want to add?
Exactly. I mean, an experienced team is what you need. I don't have the science background to go and create a device, right? But I've got the expertise in the financial world. Rita doesn't really have the science background either to create a device, but she understands the FDA incredibly. Most of our clients really understand the science and the engineering behind what they're building. Again, back to that three-legged stool. You need the product, you need the science, you need the understanding of the regulatory processes that you're going to have to go through, and you need an understanding of what the market's willing to pay for and how it's going to fund what you're doing. So, again, teamwork.
Yeah, exactly. And we're all engineers. It's not like we don't get it, but we don't invent it. we certainly understand the problem, but we don't invent the idea. But we definitely help differentiate that idea. We can see immediately how to differentiate it, whether it means from the technology or from the business standpoint, as Richard is explaining.
That's it for today's episode of Before You Build It. Our special mini-series is part of the MedTech Smarts with Rita. A huge thanks to Rita King and Richard Holcomb from MethodSense for sharing their hard-won lessons and practical guidance. Whether you're still at the concept stage or gearing up to raise your Series A, remember, your regulatory and quality strategy isn't just a box to check. It's a core part of your business model. In our next episode, we'll dive into investor promises, what's realistic, what's risky, and how to tell the right story from day one. Thanks for listening, and we'll see you next time on MedTech Smarts with Rita.